Hi, this is Jennifer Coluciello, and for this week's assignment we were told to pick one of the videos and give a little bit of commentary on that. So I chose to talk about the video, Coffee Lowers Stroke Risk. When it comes to medical research, there are a couple factors that still need to be considered. This video is a really good example for me of that. Now, I'm a big coffee fan, and I do drink 2 to 3 cups a day, so this definitely jumped out at me. But there's a few big considerations. The first one really becomes credibility. So one of the things they pointed out in this review was that the National Institute of Health, the NIH, actually funded this study. That lends credibility specifically because there's no potential conflict of interest or bias related to the performance or the results and outcomes of this study. Additionally, it was performed at UCLA's Stroke Center, and this is a very well-respected, world-renowned healthcare institution, which further lends to the credibility of the results. The second thing I consider is the sample size. While this is not the largest of studies, it did include about 20,000 people, which is still a large enough cohort to gain some verifiable and actionable data, and definitely begs more of a view and a look at. The third thing I want to think about is the actual conclusion that they came to. So the conclusion reached in this study is that the risk of stroke decreased in participants who drank more coffee, specifically 6 or more cups per day. While I myself am thrilled to hear that as a coffee aficionado myself, I do have a few questions before I just automatically increase my daily consumption. And that includes, what were the comorbidities of these patients and these participants? Were they originally drinking less coffee for other reasons? Did they have other health issues? Are there things that would increase their risk of stroke in and of themselves? Were they dealing with certain health issues that actually caused them to stay away from coffee? Things such as hypertension, tachycardia, atrial fibrillation, diabetes, weight issues. Any of these things could potentially cause underlying increase in risk of a stroke itself. Coronary artery disease is another one. Were they avoiding caffeine intake because of some of these other issues? Are they avoiding coffee because they don't like the taste and they can't have the sugar, say in a diabetic patient? There are lots of other things to consider. Just because they drank less coffee does not necessarily mean that there's a direct cause and effect relationship between those two items. So I really want to find out more about the participants in this study. What were their underlying comorbidities? What were their initial ages? What were their other risk factors that were involved? The fourth thing that I really want to think about is that while there are benefits to coffee itself, there are also some risks. So the benefits we look at obviously include, it helps me wake up every day, it helps me think a little bit better, it does help with bronchodilation. I have COPD myself, and the bronchodilation from the caffeine and the heat actually does make it easier for me to breathe. It does help with mood elevation. That may be partly placebo, but could be the caffeine. Plus, to be honest, the coffee itself gives me almost what we call a Twix factor. If I have staff or students that are coming to me with a problem and I need to filter my response a little bit, having something that I can drink gives me a moment to do that before I react. So that definitely helps in that aspect. But there are risks to coffee, specifically in relation to the caffeine and potentially a higher amount of that caffeine quantity. The caffeine itself can increase the heart rate. It can increase your blood pressure. Depending on the amount of intake, you could even lead to tremors or palpitations. This could cause significant issues. So this is not just something to take more of. Unfortunately, because of that and all of those considerations, while I love the initial sounding of this study, that coffee lowers my stroke risk, great. But when considering that this was not the hugest of sample size and there are questions regarding the existing comorbidities and existing stroke risk of the participants themselves, along with the other risks of a higher caffeine intake. There are some questions that still need to be answered, but let's face it, the fact that it jumps out at you for coffee lovers is great, but there are some questions and there is some caution, and I think this is something that needs to be applied across all medical research. Just because we see a correlation does not mean it's a direct cause and effect relationship, and that can sometimes be misleading to the general public if they're not looking at it that way. So it's a lot to think about, but at the moment, I'm actually going to go drink another cup of coffee.